Hello, everybody. Welcome to another Holistic Health Hour. Remember, if you have questions that you want to submit, you can go to holistichealthhour.com. Um, you can also find a link at um, our chronic Lyme disease and page and our Connor's Clinic page. Also, remember, everyone, that if you don't get your question answered, we have well over 1,000 blog posts that you could get to. So if you go to connorsclinic.com, search in the search bar, we either have a page or a blog post on pretty much anything you can think of. And I highly recommend that people um, get on our courses. I'm going to talk about that because of this first question that came in. So our first question that came in, remember, you can chat your questions in too. I'll try to keep an eye on that um, as well. Okay, so first question that came in, any suggestions for reducing a goiter naturally for someone who is hyperthyroid, as well as reverse the hyperthyroidism of not taking any medication for this condition? So hyperthyroid is what's called Graves' disease, and that is an autoimmune condition. So you have antibodies that have developed. With autoimmune disease is when you develop antibodies. Your immune system makes antibodies against your own tissue. And then you have destruction of that tissue. And with Graves' disease or hyperthyroidism, you have rapid destruction of the tissue that spills out T3. So normally your thyroid gland secretes thyroid hormone in the form of mainly T4. So you have T3 and T4. 95% of the thyroid hormone released by the thyroid gland is T4. That is not in the active form. T3 is the active form. So it releases only about 5% in the active form. T4 is then converted to T3 gradually over time throughout the day in the gut and in the liver, so that you don't get this spike. You need this nice balance of T3 hormone function in your body. So when a person notices hyperthyroid symptoms, they'll notice kind of like ants crawling under their skin. They'll have maybe a increase in heart palpitations. They'll have not bradycardia, but increased heart palpitations. They'll feel, just uneasy. Long-term issues with Graves' disease are bulging eyes. Graves' disease can be very serious, so you want to make sure you get that checked. If someone called and they had acute Graves' disease symptoms, they went and got checked and their T3 was elevated, I don't think you should fool around with it. I think you should go get medication for it. If it's relatively under control, if you've had a history of Graves' disease, but it's now under control, your labs are relatively within normal limits, you can do things about it. Even if you're going to go get medication to decrease thyroid function, still you need to dig into what are the triggers that cause it. So with every autoimmune disease, you'll find triggers that stimulate more destruction of that organ. So with the thyroid, whether you have Hashimoto's, which Hashimoto's can actually express as a hyperthyroid at different times, but it's typically expressed as a hypothyroid, or if you have Graves' disease, or if you have any other autoimmune disease, meaning you have antibodies to other self-tissue, you want to make sure that you're finding out what your triggers are. So I go into triggers in detail on our chronic disease and autoimmune course. I don't mean to push you to that. However, I probably have 50 videos in that course explaining these things. So it would be very helpful to spend $50 and join that course and start working your way through there to find those triggers, because that can greatly help a person with any autoimmune disease to calm things down. So the problem with an autoimmune disease is you're getting self-destruction of that tissue which you have antibodies against. And the common mistake that I see people make is that they're maybe going to a practitioner, that they're told that they might have Lyme disease, or they're told that they have Epstein-Barr virus, or they're told that they have some sort of chronic infection, and then they're treating that person with antivirals, antibacterial, natural things, and they think, well, you can't hurt anybody with, giving them garlic or giving them echinacea or giving them something like that, a natural anti-infective agent. But that's as far from the truth as you could get. You could hurt somebody quite badly. If you have antibodies to self-tissue, we'll just use Graves' disease or Hashimoto's, that's your thyroid gland, as an example. If you have antibodies to your thyroid gland, anything you do that is going to stimulate an immune reaction is going to cause further destruction of that which you have antibodies against, your thyroid gland in this case. When your immune system is stimulated, you're going to kill that which you have antibodies against first. So that's the benefit of having circulated antibodies against different diseases. If I have circulated antibodies, against a certain virus, and I'm exposed to that virus again, and my immune system is stimulated because of that exposure, I will kill that which I have antibodies against, which will be that virus. But if you have self-antibodies as well, you will destroy that self-tissue. So when you have self-antibodies, when you have a diagnosis of autoimmune disease, and I'll tell you, most people don't know that they do. So they might just think that they have chronic disease. They might think that, well, my problem is really that I have Lyme disease, or my problem is really that I have Epstein-Barr, or something like that. That because it showed up on this scan, or because my practitioner tested me for this and that showed up positive. While you may have that, if you also have self-antibodies and you're doing things that will stimulate an immune system in the idea that you're trying to kill that pathogen, you will be destroying self-tissue. Really, really important. I just got a blood test back from somebody, and they're showing antibodies to myelin sheath cells. That's neurological antibodies to myelin sheath cells. Your myelin sheath cells are what cover your motor neurons. And when you have destruction of myelin sheath cells, that is a demyelinating disease. That's MS. So every time that person stimulates an immune system to kill Lyme disease, per se, they've been going to different practitioners to try to do that, they're actually causing more harm than good. They're destroying self-tissue. They're progressing their autoimmune disease. And in this case, you're causing a progression of MS unknowingly, because nobody ever ran the test. So you got to run some tests to find out what's going on. Many times when people have an autoimmune disease, again, like I said, they may be treating the comorbidity of some other infection, and they're taking immune stimulators. You also run the risk of developing antibodies to other tissues. So over time, it's not uncommon that a person starts with Graves' disease or Hashimoto's disease, and now they have lupus, or now they have rheumatoid arthritis, or now they have antibodies to neural tissue. So running the antibody tests can be extremely beneficial to know what you need to try to protect. That's just getting a diagnosis. Then you want to run some different tests to find out what are your triggers. You can have triggers that are environmental triggers from chemicals and toxins and poisons in the environment. You can have triggers from food sensitivities, so food antibodies. So how do you, like I said, you can't stimulate your immune system. You got to be very careful not to stimulate your immune system if you have self-antibodies, antibodies to self-tissue. But if you're eating something that you have antibodies against, let's use gluten as an example. Let's say you have gliadin antibodies to different gliadin peptides, and you're eating gluten on a daily basis, you're firing an immune response every time you eat that. So you're going to have self-tissue destruction every time you eat gluten. That's a major issue. So that's a trigger. So you might not even have stomach issues. It might not bother you at all, but you're causing self-tissue destruction at that which you have antibodies against, whether it be the thyroid or myelin sheath cells, every time you eat that. So if you know you have antibodies to self-tissue, aka you know you have an autoimmune disease, you have to start digging in to find those triggers. You could do different lab tests, different antibody tests against chemicals, different antibody tests against foods. antibody tests against environmental things to find out what those triggers are. And you have to put on your Sherlock Holmes hat, what I tell everybody, and start looking for, when I do this, it does make me feel worse. So uh, that's how you would treat, that's how you really have to treat an autoimmune disease. There isn't like a secret supplement for treating an autoimmune disease. You have to calm down the immune system. I guess the secret supplement for autoimmune disease is to make sure you eat the wrong supplements. That's step number one. Okay, next question. How do zeolites work? Is there anyone who shouldn't use zeolite? So zeolites fall into the category of chelators. So a chelator is something that you absorb across your gut membrane. So if you're taking it orally, you're absorbing that product, and it's basically searching out and grabbing onto things and pulling things out of your body. So the companies that sell these chelators say things like, well, everybody's got heavy metals, everybody's got toxins, so everybody should be taking a chelator on a daily basis. The problem with that is that it may be true that everybody's got toxins and everybody has heavy metals. But here's two caveats on taking chelators. Number one is the process of chelation out of the tissues is that you're grabbing stuff out of the tissues or out of the cells and bringing it back through the lymph system into the bloodstream. It's carried through the bloodstream through your liver. And then your liver has to grab toxins out of the blood and put them through what's called phase 1, phase 2, and phase 3 detoxification pathways. In phase 3, it puts it into the bile, and then the bile travels down to the gallbladder. That's what I call phase 4. And from the gallbladder, it has to be secreted into the duodenum. That's the first part of the small intestine. Then it travels through the small intestine, and you want to make sure that your intestinal transit time is good, that you're not reabsorbing those. So you'll reabsorb toxins that your liver does all this work through these different phases and get it into the gallbladder. Your gallbladder does all this work to get it into the intestinal tract. Then if your intestinal tract is slow, meaning you're constipated, which I call phase 6 detoxification, then you have a greater risk of reabsorbing that, or if you have leaky gut issues. So if you have any intestinal permeability issues, you can reabsorb those toxins. That's what I call phase 5. So phase 5 is getting it through the gut. Phase 6 is getting it into the toilet. So if you have to start with phase 6. So I explain this in detail in my book, the 7 phases of detox. So phase 6 is really the end point, getting it into the toilet. Phase 5 is making sure you're not reabsorbing it because you have a damaged gut wall. So I don't think you should be doing zeolites until you heal the gut. And then you make sure that you're using binders in the gut. So technically a binder, zeolite can act like a binder as well, but zeolite is absorbed, so it acts like a chelator. But technically a binder will mainly stay in the gut and hold on to things in the gut so you don't reabsorb them. So making sure that you have a healthy gut so you're not reabsorbing things, making sure you're binding things so that you're not reabsorbing them, then going backwards again, going to the gallbladder. How's your gallbladder functioning? So if your gallbladder is sluggish and it's not functioning well, then making sure you're cleaning out the gallbladder, you're flushing it in different ways. There's different gallbladder flushes that one could do. So we're talking about detoxification pathways here. So really, you have to work backwards from phase 6 to phase 5 to phase 4, 3, 2, 1, and then you do phase 0, which is pulling stuff out of the tissue. So how does zeolite work? It's mainly a chelator. Should anybody not be taking zeolite? Yeah, anybody who has not dealt with the other phases of detoxification. So I have people that say, I go every 3 days. Yeah, that's kind of it. I have a bowel movement every 3 days. Okay, well, you have no business doing any sort of detoxification. You need to get your bowel movements in proper alignment. You eat corn today, you should see it in your bowel movement the next morning. That should be your intestinal transit time. You should be feeling like you're getting everything cleaned out on a daily basis. Super, super important. You got gut issues, you got inflammation issues. Going back to doing a Cyrex 10 panel, looking for food sensitivities. If you have inflammation in the gut because you got a ton of food sensitivities that you haven't dealt with, you know that you have damaged gut border, then you could do a Cyrex Array 2 and 3X to look for gut barrier issues if you want to. If you know you have gut barrier issues already, you should have no business doing zeolite or doing any sort of chelator. You need to heal the gut first, and then working that way backwards. So I said there's two caveats to using a chelator. One is that is what I just explained, that all your detox pathways are open and doing well. I've worked on healing my gut. I have daily bowel movements really healthy. I know that I'm not reabsorbing things. I'm taking a binder, away from food to help grab onto things in the gut. I feel like I got that all under control. Now I want to use zeolite. Well, there's one other caveat to using a chelator. So I have labeled chelators into categories of mild, moderate, and strong chelators. So a mild chelator would be like chlorella. A mild chelator would be like modified citrus pectin. A moderate chelator, I have a blog post on it, so go look at our blog post on chelators and you'll see that. But zeolite would fall into a moderate to a strong chelator. And you have to be careful with moderate to strong chelators if you have metal in your mouth. If you have mercury fillings, you can look in your mouth. If you have silver fillings, then you really shouldn't be using heavy chelators, because you can pull those and you could just be making yourself more toxic. So you have to be careful with that. There's some gray area around that. So that would be my only other caveat to using zeolite or any heavy chelators is do you have metal in your tissue, or do you have any implanted devices that could make you worse? So I would stick to more moderate to more milder chelators. Remember, I would agree with the truth that probably everybody has heavy metals, everybody has toxins. It doesn't mean that you should always be trying to get rid of them. The truth is, you could do heavy metal chelation your whole life, and you're always going to have toxins. It just is what it is. I don't really think that you're ever going to not have toxins in your body. I just don't think that's a possibility. So that shouldn't be our purpose, is to, I have to get rid of all the toxins in my body. That's really my purpose in life. That really shouldn't be our purpose in life. Our purpose is to be as healthy as possible, and to make sure that our rate of detoxification exceeds the rate of our toxification, if that's a word. So we want to be working on our detox pathways so that they're open and they're healthy. Our liver is healthy. That's one of the most important things. That's really your biggest stumbling block with detoxification, with cellular detoxification, is having a healthy liver. So things that we do to abuse our liver abuses our really has some limiting factors on our rate of detoxification, and that's a key factor. Okay, next question. Can you talk about treatment for PANS and Pandas? So PANS and Pandas is inflammation and damage to the brain, many times after a strep infection, many times after antibiotic use, different types of infection that can affect the brain. I'm going to refer you to a video on my website. There's a blog post. Let me look it up real quick, because I think the blog post is called Neuroinflammation. Yeah. So it's called Neuroinflammation and Microglial Priming. Go to our website, connorsclinic.com. Go to neuroinflammation, Neuro inflammation, one word, and microglial priming. If you just type in neuro, you'll start to see it in the little search bar. And I have about a 30-minute video that goes over goes over that. There's many different causes to microglial priming. So you have different cells in your brain. You have your neurons. That's what everybody knows about. Your neurons carry information. And I mentioned the myelin sheath cells earlier. Well, your myelin sheath cells surround some of those neurons, and that's what makes that speed of conductivity. So when you have damage to those myelin sheath cells, then it slows that conductivity, and we end up having motor issues and all sorts of problems. But there's another type of cell in your brain called glial cells, and those are separated into different types of glial cells. Glial is actually Latin for glue, because that's what they thought it was when they first discovered it. Oh, that's just the glue that kind of holds the neurons together. Well, that's not true. Just like anything, there's no wasted things in your body. Glial cells have very distinct functions. There's different types of glial cells, and the important one about neuroinflammation has to do with the type of glial cells called microglial cells. Microglial cells are your immune function in the brain, and they can get damaged. They can get damaged from Lyme disease. They can get damaged from strep. They can get damaged from anything that can cross the blood-brain barrier. Let's just say that. Anything that can cross the blood-brain barrier can damage microglial cells. Your blood-brain barrier is made up of a different type of glial cells called an astrocyte. And if you're dealing with a child under about 3 years old, their astrocytes are not wrapping their arterial system in the brain, so they basically do not have a blood-brain barrier. So with a child, things can get across the blood-brain barrier because it's not there. With an adult, things get across the blood-brain barrier because some things will pass and things will damage the blood-brain barrier. So we can have things that damage the blood-brain barrier. Even traumas. Traumas are big to damage the blood-brain barrier and big in damaging microglial cells. So anything that gets across the blood-brain barrier, like a toxin, that's the bad thing about the injections that are recommended for childhoods and for different diseases, because they contain chemicals that are nanoparticles. So they contain nano aluminum, and nano aluminum is, that's not so harmful because it's really small. Well, it's actually more harmful because it's in a nano form, because it easily and readily crosses the blood-brain barrier, and it easily and readily damages the microglial cells. So microglial cells get damaged, and that's they're in what's called a prime condition, and that's hyperinflammatory. I could go on for about an hour on this, but I'm going to refer you to that video, because that will really help explain what's going on with any neural inflammation, whether it's from, and we give it a name, or Pandas, or whether it's from Lyme disease, whether it's from chemo-induced neurotoxicity, and we call it chemo brain, whether it's from some chemical toxicity, or whether it's from post-concussive disorders. It's all the same. You're dealing with microglial priming. So there's really two levels of danger when you talk about brain inflammation. You can get microglial priming, which could be bad enough as it is, could cause all sorts of dysfunction, and you're going to have the dysfunction in the brain that is happening. So if you have more microglial priming in the prefrontal cortex, that's this part of the brain, that's your executive function of the brain, then you're going to have dysfunction in memory and understanding and executive function. You're not going to have cognitive disorders. If it's in the frontal motor cortex, which is a little farther back in the brain, then you can have motor issues and some tremor issues and motor conductivity issues and muscle fasciculation issues. If it's in the parietal lobe, then you're going to have more sensory issues. So you can have pain that is in my left knee today, and now that doesn't hurt, but it's my right ankle is hurting. I can't figure out. And there's nothing wrong with my left knee or my right ankle, and it can travel around because the inflammation in the microglial priming is in that part of the brain, in the parietal lobe, where that sensory input comes back in. So If it's in the temporal lobe, you could have hearing issues, and balance issues and vestibular issues. If it's in the cerebellum, you're definitely going to have vestibular issues, balance issues. If it's in the back of the brain, you could have vision issues. So it depends on where that is taking place. PANS and PANDAS is the same thing. If it's in the midbrain, you could have all sorts of autonomic issues. So this damage can take place anywhere in the brain, so it can give a collection of symptoms based upon where that damage exists. I said there's really two levels of damage that is caused from neural inflammation. One is the microglial priming, which I said is bad enough, but the second one is even worse. That's when we end up developing antibodies to neural tissue. So there is a test for that. You could do Cyrex Array 7X, so you can see if you have antibodies to any neural tissue. I tested somebody the other day, and they have neural antibodies to myelin sheath cells. That's just one thing that test tests for. Well, now you know you're going to have destruction of myelin sheath cells every time you stimulate an immune system reaction for anything. Let's say you even get a cold and your immune system upticks, you're going to have more destruction of those myelin sheath cells. You're going to have more demyelination taking place. Again, that could be anywhere where that is in the brain. It's going to be on myelin sheath cells. Not every cell, not every neuron is myelinated, but all your motor neurons are going to be myelinated, and you're going to definitely have motor neuron issues. So the danger to that is what I already stated. If I have antibodies to neural tissue, every time I stimulate an immune system reaction for anything, it's going to get worse. And one of the chief errors in care from a natural perspective is doctors will say, well, it's from this infection, so it only makes sense to treat that infection. We need to give herbals and things that are going to stimulate the immune system to kill that infection. That's a really wrong thing to do. So again, you'll find a lot more information on the autoimmune course on that. It's pretty cheap to do that. I recommend spend the $50 and start watching some of those videos and work your way through that course. There's a lot on there, and I add stuff on there literally weekly. So even if you're on module 4 now, go back to the first 3 modules, because I probably added a bunch of stuff. So every time I'm learning new stuff, I put it on that course, anything that has to do with autoimmune disease. So I'll make a video about it or something like that, and I'll put it on that course. So dealing with PANS and PANDAS is dealing with inflammation of the brain. It could be just microglial priming that is the cause of that person's symptoms, and that would be bad enough. Or you could have neural antibodies that have been created, and you can test for that. Can't test for microglial priming. It's mainly just signs and symptoms that a person is having. And still dealing with it, you still have to deal with triggers. So super important. But in that video, I explained a lot of that. Okay, so we have more questions, but somebody did ask a question online here, so I want to get to that one. Just wondering if you can correct erectile dysfunction. I have been unable to perform long enough during intercourse to finish. Okay, so yes, erectile dysfunction has to do with the nitric oxide issue. Is it correctable? Well, it's not something I treated. I don't really treat that, but I do treat endothelial dysfunction issues. So it's really on the same course of care. So endothelial dysfunction, so your endothelium is the single layer lining of your blood vessels. They're epithelial cells. We call them endothelial cells in the bloodstream. And underneath the endothelial cells, you have blood vessels. And you have smooth muscle tissue. And both of them are sensitive to nitric oxide. It's called ENOS, endothelial nitric oxide synthase. You actually have receptors in the muscles and receptors on the in the blood vessels as well. And you have to stimulate with, that's a form of nitric oxide, ENOS, to stimulate to contract, which increases the blood flow. So it's going to contract the blood vessels. It's going to squish together the endothelial cells. It's going to make a smaller lumen for the blood to flow, which increases blood flow, the speed of blood flow. And from a blood pressure perspective, it's increasing blood pressure. For someone who has increased high levels of blood pressure, so they have, they go to the doctor, they have high blood pressure, you want to use nitric oxide to relax those smooth muscles. So nitric oxide works to relax those muscles. Absence of nitric oxide increases that muscle contraction and increases blood flow. So with erectile dysfunction, you need nitric oxide to help with the constriction of blood flow to that tissue. So that's how you would treat that. That's not our specialty, but that can be, and always is, an issue with nitric oxide. Matter of fact, the purple pill, that's exactly what it does. The danger of that is that it does infect your heart. So the danger of using the purple pill for erectile dysfunction is that it does affect your heart, and it is going to affect your blood pressure. So you have to be very careful with the use of that. So somebody who has a history of heart issues, history of blood pressure issues, typically it's not recommended. The doctors still prescribe that. It's really easy to get, but you got to be really careful with that. Nitric oxide you have to be careful with nitric oxide as well if you have any history of cancer. So a history of cancer, you do not want to be using nitric oxide supplementation. It's very common to use nitric oxide with bodybuilders as well. It can help with workout fatigue. It can help with other workout issues with bodybuilding. If you have a history of cancer, you don't want to do that. The reason is nitric oxide. The other thing nitric oxide does, which is actually good for the heart, is it increases what's called vascular endothelial growth factor. You may have heard of that as VEGF, vascular endothelial growth factor, which is good if you have heart issues. You want the heart to be stimulated to lay down new vessels, but it's not good if you have cancer. So especially if you have not leukemia, but if you have a hard cancer, like a tumor type cancer, VEGF, vascular endothelial growth factor stimulation, will lay down new vessels, so it will actually be able to feed the cancer and give it the ability to continue to grow. So many drugs and nutritional therapies for cancer patients are to block VEGF. So you would not use nitric oxide with anybody who has a history of cancer. So a lot of things that you would do for heart disease or maybe other comorbidities like discussed, you would not do for cancer. So be aware of that too. Next question, what is the best multiple vitamin? Well, there's a lot of multiple vitamins on the market. Your key things that you should look at with vitamins themselves is how do you know the quality? How are you supposed to know the quality if it's got a pretty fancy label and it looks nice and the druggist said it's a great supplement? Who says? So understand there's a difference in supplements between synthetic portions of supplements, and I do believe that there's a use for those, and a whole food supplement. So the difference in that is a whole food supplement is made just basically from the food itself, and so like a greens drink, would be a whole food supplement. There's not a whole lot of whole food multiples on the market. We do have one. We actually have it private labeled as a prenatal, but it is a whole food supplement. It's really the only whole food supplement that we have as far as like a multivitamin, besides the different like Greens First products that are out there. So a lot of our patients will use Greens First. That comes in capsules, and that comes in a powder that you can mix as a smoothie or something like that. So those are always the best. A whole food product is always the best as far as a multiple goes. All the other supplements that are out there, you have to be careful with as a multiple, because most of them are synthetic. And especially the synthetic Bs and some of the other synthetic vitamins, you don't absorb well, your body doesn't use well. So you have to be careful with that. So I'm not a big fan of just finding a multiple and taking a multiple thinking that you've solved your problems. Also because they're not tailored to what you have going on. Remember, I just said that people with cancer have to be careful of things that maybe somebody with just heart disease and they don't have a history of cancer. Somebody with cancer should not be taking a multiple that has copper. Most multiples out there, because they're using the synthetic supplements, they don't care about how their minerals are chelated. So I'll talk about that in just a second. So it's really improperly chelated minerals, which are garbage and can actually be harmful for you. Maybe have iodine in it, which I'm not a big fan of iodine because the issue with thyroid issues, iodine is a main cause of Hashimoto's and Graves' disease. And most of them have a very poor source of folate as folic acid. And no human being should consume folic acid. Folic acid is a synthetic folate. And it has been hypothesized that folic acid, the synthetic folate, is what has caused defects in a gene called the MTHFR gene. And that leads to issues with that person's ability to even process natural folate that you'd get in your foods. And that is an issue in our society. So there's a lot of garbage supplements out there that nobody should be taking. So many times when people come in and they're taking the supplement and it's like, sorry, do you mind if we just throw this away? This is not good for you to give to your human or a dog or anything. They're not good for anybody to consume. And then so when you look at a supplement, your key things that you look at are, if I could think, you look at the folic acid. Is it folate as methyl tetrahydrofolate, tetrahydrofolate? Well, then that's a good folate. But again, it gets more technical because somebody with cancer shouldn't be taking that. So is the B12 cyanocobalamin? Nobody should be taking that. Throw it away. Is it methylcobalamin? Well, a cancer patient shouldn't be taking that. Is it adenosylcobalamin, a hydroxycobalamin? Yeah, that's a good form of cobalamin, that they cared about that supplement. Are the minerals chelated correctly? What's the calcium? Is it calcium carbonate? If there's any of these are red flags for me. Oh, it's calcium carbonate. They didn't care about what they put in that supplement then. So understand, any supplement, hey, let's sell supplements. We can make a lot of money selling supplements. Let's make a multiple. Well, what should we do? Let's put the best stuff in there. Oh, that's too expensive. Let's just put this other junk in there. We can make a whole lot more money. Okay, let's do that. I'm sorry, but that's exactly what takes place in a lot of these companies. A lot of the supplement companies have been purchased by drug companies, and they don't necessarily have your best interest in mind. So I can look at the back of a supplement bottle and tell you whether you should take it or not by looking at these key things. Doesn't have folic acid? Just throw it away. Is the calcium carbonate? Throw the thing away. Is the B12 cyanocobalamin? Throw the thing away. If you have cancer, then you have to look out for other things that you should not be taking. So minerals should be chelated with a double bond to an amino acid. There's only 2 companies in the world that do that. It's called Trax, and let me think of the other one. But they don't sell their own supplements. They sell to good supplement companies. So if it says Trax or Albion, that's the other name, then you know it's a good mineral chelate in there. If it isn't a Trax or an Albion mineral, then it's probably not double bonded to an amino acid and you shouldn't be taking it. If you take calcium carbonate, it's like eating limestone. Okay, you're not supposed to eat limestone. We're not supposed to eat trace minerals that are not bonded, double bond to an amino acid. trace minerals are what are in the soil. Soil-based minerals then are taken by a plant and converted and bonded to a double bond amino acid, and then we eat plants, or we eat animals that ate plants. So that's how you get your minerals. You don't get your minerals by eating dirt. So a lot of the minerals that are in these poorly formulated mineral supplements and multi-minerals and multivitamins are just the cheapest soil-based minerals, which are not, they're not good human consumption. You do absorb, those are the things that damage your gut. If you do absorb them, they don't get into cells to function as calcium or magnesium or selenium. They end up getting deposited at ligamentous insertion sites. They get deposited at joint capsules. They can form degenerative arthrotides and cause blood issues. They can get bonded to places that they shouldn't bond to. They can damage arteries. They're not good things. So you're better off not taking any supplements. You're better off getting them from your food if you possibly can. If you want to supplement, that's the whole idea of a supplement. You're supplementing your diet. You want to get it in a whole food form as possible, and you have to know a little bit about supplements to make sure you're not getting bamboozled into buying garbage. So, so the best multiple, I would say, would be a whole food greens product, something like that. Or we have one that's actually labeled prenatal complete, but it's a good whole food supplement. But it's not for cancer patients because it does have copper in it. That kind of leads to this next question. I don't know if it's the same person that asked it, but the question is, are minerals necessary if you have a good diet? It depends. So one would argue that our food, even if we have a really good diet, doesn't contain the same amount of vitamins and minerals that a good diet did 100 years ago. And I think that's a valid argument. I mean, there's been tests done on how much vitamin C is in an orange, let's say, versus how much it was 100 years ago. There is that data on some of the nutrients, and it is a sad story because our soils are depleted often, and even if we have a good diet, we may be consuming a lot of things that damage the gut wall, so we're not absorbing as many things. But so technically, no, you should be able to get everything from your diet. But there's times where our body is under more stress. Okay, like minerals are needed more in the summer because you're sweating out a lot of minerals when you are outside and you're working outside. And if you're sweating a lot, you're going to need more minerals. Minerals are necessary for different things, especially magnesium. That's probably the number one mineral deficiency. Magnesium deficiency can lead to all sorts of different issues. It's necessary in probably about 500 to 700 different metabolic functions in our body. It's a cofactor. So it's something, a good mineral supplement is not expensive either. So yes and no, I would say. If you have a really great diet, maybe you don't need minerals, but at different times of stress, you do. So just be aware of that. Next question. When eating spicy foods, I get heartburn. What does this mean, and how can I get rid of it? Well, we had a question last week about heartburn, and my answer was that you do want to check if you have a hiatal hernia. So remember what I said last week about what a hiatal hernia is when your stomach can herniate up in through the hiatus, the hole in your diaphragm. So it herniates into that sphincter, and then you get a little bubble on the superior side of that sphincter, and that can belch up acid. And then you think really your problem is too much acid. When you eat spicy foods, you get heartburn. It's it's really most likely because you're not properly digesting them. Or if you have a hiatal hernia, that the spice in that food can stay above that diaphragm in that part of the stomach that is herniated above the diaphragm, and then it will regurgitate up your throat, and you'll have that heartburn. So I would definitely check about a hiatal hernia. If you don't go to a practitioner that works on things like that, I actually have a video on our website, like I stated last week, on how to take care of your hiatal hernia. So I'm actually in the video teaching my staff how to do it. So go to our website, connersclinic.com, search hiatal hernia, and you'll see a video where I'm teaching how to pull down the stomach and help with that. Taking digestive enzymes will be helpful too. Most likely, a person that has this also has a hypochlorhydria, which is a decreased stomach acid production. So look on that same website and search hypochlorhydria or HCl, low chlorhydria, HCl production in the stomach. So hypochlorhydria issues lead to hiatal hernias, lead to H. pylori issues, lead to indigestion, lead to intrinsic factor decrease, B12 deficiency, lead to just about everything. So look at that. So when you have symptoms, remember your symptoms are telling you something about something going on, right? So the worst thing that you could do, I eat spicy foods and it really bothers my stomach, so I just take Tums. Or I went and got a prescription to omeprazole. That's like, I'm sorry, but it's that if you just shoot yourself, the pain will go away too, right? So don't do that. This makes no sense. You're treating the symptom by covering it up. It's like saying, oh, my light comes on in the car, the engine light, so I fixed it. I put a piece of black tape over it. That's ridiculous, right? So I'm trying to bring it to absurdity. Well, we do that with our body all the time. So you take a drug or something that will cover up the symptom instead of saying, this is a symptom of a problem. Well, I know the person that's asking this question probably doesn't do that, because that's why you're asking the question, right? So dig in to find out why. Always find out why. So that just led to my thought process there. And then our last question for the day, unless we have some on the chat, I don't think so right now, is why do so many people say to drink apple cider vinegar? Well, apple cider vinegar is an acid. So it's a moderate acid, mild to moderate acid. I think the pH, I don't remember what the pH of apple cider vinegar is. It's not as strong as HCl. Your stomach makes HCl. So the stomach cells, parietal cells in the stomach, make hydrochloric acid for the purpose of digesting food. So HCl made in your stomach is for the purpose of digesting food. It also has a side purpose of killing any parasites that you may have ingested. So pathogens, bacteria, and parasites that you ingested by eating your sushi or your sandwich are killed by a proper pH in your stomach, which needs to be extremely acidic. So when you have a very acidic stomach, then you're going to digest food well. You also need an acidic stomach in order to secrete intrinsic factor, which is exactly how you absorb B12. So a lot of people with B12 deficiency, always going to look at hypochlorhydria. So the reason why people would consume apple cider vinegar is because it helps with digestion. That's really the only reason why you would take apple cider vinegar. So in my blog on hypochlorhydria, it's best to go right to HCl. I mean, if you can tolerate HCl, so if you start taking HCl capsules with your food because you're trying to help your stomach digestion, and wow, it will either instantly help your stomach digestion. I mean, instantly it'll help the first day you start taking it. Or you could have severe pain. Oh my gosh, I took a couple HCl tablets with my food and I ate something. Man, my stomach is killing me. What's wrong? You quite possibly have an ulcer. So if you do have an ulcer, you could back off on the HCl, take something that's a little less acidic. It's going to be a little less better for you too, but it's going to be more tolerable possibly by using apple cider vinegar. Now I have a formula on how to do this. You start with HCl. If that's again too harsh on your stomach, it's a sign that you quite possibly have an ulcer. You go back off and you try to use apple cider vinegar. If that's too harsh on you too, then you have to heal the stomach. So you have to heal that ulcer. So then you have to do some things to heal that ulcer. And I have some information in the blog post on that, using deglycerized licorice and aloe and different things like that to heal the lining of the stomach. And then you have to work backwards and go back to apple cider vinegar. Tolerate that well, then you start on HCl. You tolerate that well, and you can start healing your gut. That brings us all the way around to the first question about detoxifying. And you have to start with healing your intestinal tract. You do that from the top down, and you heal and you don't start detoxifying. You have to heal that detoxification pathway from the bottom up, which is making sure you're eliminating, making sure you're binding, making sure your gallbladder's working, your liver's working before you have any business pulling stuff out of the tissues. Healing the stomach, making sure that your HCl production is good, supporting digestive enzyme production, taking some pressure off of your pancreas, so that you can heal your stomach and heal your gut. So gut issues, it's been said that, everything really starts in the gut. Well, it's not altogether true, but there's a lot of truth to that. So working on those pathways is very important. Okay, a couple more questions came in. We've got a couple more minutes, so I do want to try to get to these. All right. Have you treated autoimmune hepatitis? Yes, so autoimmune disease, you have to join that course. I mean, it's just too complex. And a lot of practitioners, a lot of really good functional medicine practitioners, I hate to say this because it sounds egotistic, but they're treating it wrong. So again, if they're using immune stimulators on somebody that has an autoimmune disease, they're not understanding some basics of autoimmune disease. So go to our chronic disease and autoimmune course, and you get to that by just going to connorsclinic.com. On the top, you'll see courses. Click on the autoimmune, chronic disease and autoimmune course. I think it's $50. I mean, come on, $50. You're going to get a college education in there and go through that, and you're going to learn how to deal with autoimmune disease and how to test for different things to find your triggers and to calm this all down. So, and every autoimmune disease is treated very similarly. You have to find out what's triggering it, because every time you are triggering your immune response, if you haven't figured out those triggers, you're getting further destruction. So whether it's your liver or your thyroid or your brain, neural tissue, whatever it is, make sure that you're addressing that. Oh, another question. What do you recommend as the top healing strategies for severe rheumatoid arthritis? I have tried to heal possible leaky gut, largely avoided wheat and dairy, and tried a dozen prescription meds without success. So I hate to sound like a broken record, but rheumatoid arthritis is an autoimmune disorder. So you have to find those triggers. There are certain autoimmune diseases that tend to be tied to foods and to different food groups. Certain ones tend to be tied to different toxins. Rheumatoid arthritis tends to be tied to different food groups. Wheat and dairy possibly with that. Definitely lectins for rheumatoid arthritis. But again, you should test for them. Run a Cyrex Array 10 so you know what it is. Rheumatoid arthritis is often also tied to heavy metal toxicity. But again, you can test for that too. I highly recommend testing for things. How do you test for these things? Well, you join the course. So on the course, you can order labs through our Connors Clinic lab store. We have zero markup. So no matter what state you're in, it's through Rupa's lab store. It's our Connors Clinic store through Rupa. So they get a doctor in your state to sign off on your labs, and you can order labs. There are some state restrictions because New York is such a stickler, and so is New Jersey, but you can get a doctor in your state to sign off on your labs, and you can order the labs directly, and then you can make an appointment with me to go over those. So you really need to test. So it's very important to do objective testing if you really want to dig to the bottom of it. And I know sometimes the tests cost money. That's why in our lab store, we don't make a penny off of any of the labs done. Rupa adds 7% up from the lab cost, and it's a $25 charge for a doctor to sign off in your state to get it legally done. I just don't know how you could do it any less expensive than that. So all you need is join the course, and then you can make an appointment with me, and we could go over a strategy. So set up a case review with me, join the course, and we can go over a strategy. I'll specifically make some lab recommendations for you and get to the bottom of it. So, I mean, this Q&A is meant to help give you some idea of what we do, but it's also helped to give you some idea of, if you don't use us, find a practitioner that, educates and is going to dig to get to the reason why. Otherwise, like you say, tried this, tried that, dozen different prescription. Guarantee your problem is not, you're missing the prescription or even you're missing the supplement. That's just not how your body works. You got to dig to find out, and you have to run some different tests. So find a practitioner, if it's not us, that's going to dig and find these things out and knows what they're doing. So our purpose in having this live Q&A is to give you hope that there are people out there that understand this stuff. There are practitioners out there that care, that will take the time with you. So find them if you don't use us. So we have people from all over the country. We have literally people from all over the world, mainly the United States. And you're welcome to make an appointment with me. So you can do that online too on our website, connorsclinic.com. You can schedule directly, schedule online, fill out the form, and have a consult with me, and we'll go over a strategy. Also go to holistichealthhour.com. You can see all our past Holistic Health Hours. It is indexed pretty well through AI. We have that ability to index different topics, so you can find questions that you're looking for. Also, like I said at the beginning of this hour, go to connorsclinic.com, search our blog. Goodness, we have 1,000 blog posts. Also, you could go from there, you can go to videos.connorsclinic, and you'll see we have well over 1,000 videos. So, our ministry is really to try to educate. That's really my goal. That's my heart, if you can sense that. We want people to know, how to best take care of themselves. I think the more you know, the more empowered you're going to be. If you're going to give up your power to a doctor and let them do things, then they're just going to give you drugs, and you're going to be more addicted to things, and it's really not going to solve anybody's problem. So use our services and ask questions. If we didn't get you on this time, ask questions and we'll get you on next time. So go to holistichealthhour.com, submit your question. That's the best way to get it on. All right, be blessed. See you next time.